My decision to become a doctor was kind of something I started thinking about at a very young age. My younger brother had ALL, which stands for acute lymphoblastic leukemia. So my brother was diagnosed in the 90s when I was a very young age. And at that point, we were very lucky because there was so much science being done at that time that it was transitioned to the point where kids were actually having a good chance for survival with ALL. Fortunately, my brother did very well, so that kind of started my journey into medicine. I just remembered how the doctors, the nurses, the PAs treated me and my family, and I wanted to have that type of role growing up, so that's what kind of led my decision to healthcare. I think the one thing that stands out is that every little thing that I do in my clinic that my team can do makes a huge difference for patients in their everyday life. I think a lot of us take for granted for things that we have, such as vision. So nothing's more rewarding than seeing a patient who has dry eyes, macular degeneration, cataracts, whatever it may be, doing some small thing for them that makes a huge impact on their day-to-day life. I kind of decided on ophthalmology at a very late stage in medical school. I entered medical school wanting to do pediatric oncology. And at a very early stage in medical school, I found a mentor who's a pediatric oncologist. One of the things that he had me do early on is to sit with him through family meetings. At the family meetings, you sit with the team of doctors, nurses, you sit with the family and the patient. You kind of talk to them about the prognosis, the stages moving forward. Fortunately, my brother did very well with his ALL treatment for leukemia, but not every patient did. And the fairness of life, I guess, is what kind of pulled me away from pediatric oncology and kind of pushed me towards a different field. At that point in my medical school career, I had found many fields rewarding. I liked anesthesia, I liked internal medicine, but ophthalmology kind of had a little bit of everything that I really wanted. For example, with ophthalmology, I see patients sometimes 2 to 3 times a year, over 20, 30 plus years, so I get to develop a very close relationship with my patients. Also within ophthalmology, it is a surgical field. So if patients who come with me with glaucoma or with cataracts, a simple eye procedure, a cataract surgery, glaucoma laser, cataract laser can make a huge, profound impact. So it had a good balance between long-term care and also the rewards of being a surgeon. I think vision itself is such a key part in everyday life. Almost everything we do involves our eyes in one aspect or another. If you're on the computer, if you're working, if you're interacting, you're driving, vision is one of the key senses. So I think the ability to take care of patients' eyesight and vision is something that compels me to be an ophthalmologist. I love working at Marietta Eye Clinic, and I think it's just the people that I get to work with every single day. I know when patients come to me, they come to see me, but what they don't realize is behind the scenes is a team of amazing people from the front desk, the call center, my technicians who I love working with. They make my day special. They can tell whenever I feel behind, anxious, or whatever it may be, and they do these small things that, one, takes care of the patients, and two, just makes it for an overall great day. So I love the people that I work with. I enjoy many things outside my job as an ophthalmologist. I enjoy spending time with my family, my young daughter. I love playing outside with her, playing tag, and I think those moments are very precious to me. I also have a lot of hobbies I enjoy too. For example, I love video editing. I love woodworking. I think these creative channels are something that I cherish a lot, and I try to do as much as I can on the weekends. However, my daughter takes priority first and foremost, so I don't have as much time as I would like to do these things right now.